Welcome to this demonstration of the Health Data Coalition, which brings together the work of the Physicians Data Collaborative and AmCare. Let's start with a quick demonstration of the Physicians Data Collaborative, created with the support of divisions from across BC. Starting out on the dashboard, we see here the different kinds of projects and reporting that are available for users to view, including attachment initiative reports, population health reports, polypharmacy and prescribing reports, practice reflection, and data quality probes. Let's start on polypharmacy, and then click on polypharmacy greater than 10 medications. This report will show us patients over the age of 65 who are on more than 10 medications, and we can compare the individual physician practice data with a small group of peers and with the whole network. When we hover over network, we see 8,924 patients over 65 are in the network for this report, and the average for the network shows that 16% are on more than 10 meds. Hovering over the group, we see a similar proportion at 14.6%, with this particular clinician at a rate of 8.9%, so they can see how their data compares to the group and to the network. Click here to view the data in pie chart format. Click back to polypharmacy and we see some of the other reports, including top 10 most prescribed medication classes, use of statins for primary and secondary prevention, and use of digoxin over 0.125 per day with patients with impaired renal function. Next, we'll click on population health, and let's take a look at documented prevalence of diabetes. Here you can see that the clinician has 700 diabetic patients representing 9% of their population. The provincial average is approximately 9%. And we can see that in the network there are currently 31,918 anonymized aggregate patient records, of which 1,667 are diabetic, or 5%. Heading back to population health, if we now click on prevalence of hypertension, we can see how this clinician compares. Looking at it in pie chart format, we note that the clinician, network, and group prevalence of hypertension is approximately the same. You can also view in line chart form, which shows changes in the prevalence of the condition over time. Now let's look at attachment. Listed here are the different graphs and reports you'll be able to export as Excel documents, things like practice population profile, practice population encounter profile, attached active patients, demographics report, and encounters report. Next, we have data quality probes. These graphs enable you to track the level of quality of your EMR data and ensure data is being captured and entered correctly. Clicking on active patients seen in the last 3 years shows clinician, group, and network are all similar. The pie chart highlights percentage contrasts, and the line chart shows how well this data has been tracked over time. You can keep track of multiple quality data points. Other examples include active patients missing gender, active patients with invalid date of birth, and much more. Finally, let's click on Practice Reflection. These are reports that support PSP education modules, including EMR data quality, pain, musculoskeletal, and end-of-life modules. These reports enable physicians to confidentially and anonymously compare themselves to peers while attending a learning module. Following the module, they can then track their progress over time as they implement what they learn. Now let's take a look at AmCare. Here is a snapshot of some of AmCare's indicator list. Now let's take a look at some AmCare reports. We'll click to run a report looking at COPD activity assessment over the past year comparing Clinic A with all of Prince George. A report will show up at the top as a bar chart and below that as a line chart looking at pneumococcal vaccine rate from 2010 to 2014 in COPD patients, comparing one clinic, the blue line, with all of Prince George, the orange line. In summary, the Health Data Coalition is an EMR-agnostic IT platform that makes it possible to compile aggregate data across hundreds of clinics and providers while maintaining patient and provider confidentiality. The HDC's platform can enable the achievement of the triple aim by providing primary care data for small groups doing peer-led learning on topics such as antibiotic stewardship and polypharmacy, PSP module education and evaluation, family practice and primary care research, MOH, health systems planning and population metrics, and division-level evaluation of local initiatives, seamlessly in the background without surveys. Thanks for taking a look at the Health Data Coalition.